The hidden dangers of Benadryl. Safer allergy alternatives you need to know. Imagine a world where an over-the-counter medicine, long considered a go-to for allergy relief, might actually pose more harm than good. That's the reality many are starting to realize about diphenhydramine, widely known by its brand name, Benadryl. Every day, Dr. Anna Wolfson witnesses cases in her clinic where people use this medication as a catch-all solution for allergic reactions, unaware of its potential dangers. And this is where it gets controversial. Despite its popularity, there are safer and more effective options available today. For instance, if someone has a food allergy and experiences a reaction, the immediate treatment is epinephrine, not diphenhydramine. Often, folks carry Benadryl to soothe symptoms like itching or hives, but that's not the proper frontline treatment during an allergic response. Diphenhydramine can cause drowsiness and mask signs of a worsening condition, potentially delaying critical medical intervention. Shedding light on this issue, experts from prestigious institutions like Johns Hopkins and the University of California, San Diego have called for removing diphenhydramine from the U.S. market altogether, labeling it outdated, risky, and less safe compared to newer antihistamines. Originally approved back in 1946, this first-generation antihistamine was widely used for allergies, insomnia, and cold symptoms, especially in the summer months to combat insect bites or pollen allergies. However, recent research reveals that diphenhydramine's risks outweigh its benefits, especially for vulnerable groups such as children and seniors. Alternatives like loratadine, Claritin, cetirizine, Zyrtec, or fexofenadine, Allegra are now recommended for allergy relief as they tend to cause fewer side effects and are safer for long-term use. The Association of Over-the-Counter Drug Manufacturers points out that while the side effects of diphenhydramine are clearly listed on packaging, it wasn't designed for sustained long-term use. When appropriately used, such medications can be very effective for treating allergies, cold symptoms, motion sickness, minor skin irritations, and temporary insomnia. These drugs work by blocking H1 receptors in the body, responsible for allergy symptoms like sneezing, itching, and a running nose. But diphenhydramine doesn't just hit these receptors, it also affects areas of the brain, leading to sedation, cognitive impairment, and in some cases, heart issues. For older adults, the risks multiply. This medication can stay in their body for up to 18 hours, causing prolonged drowsiness, confusion, and an increased chance of falling. There's also mounting evidence suggesting that long-term use of diphenhydramine might be linked to dementia development. Meanwhile, children face even greater dangers: accidental overdoses, paradoxical reactions such as sudden hyperactivity or severe drowsiness, and even fatalities, particularly from pediatric formulations, have been reported. The infamous TikTok Benadryl challenge tragically highlighted these dangers, leading to hospitalizations and, in some cases, deaths. Diphenhydramine's use should never be taken lightly, warns Dr. Wolfson. It should be administered only under medical supervision, primarily for allergic reactions or motion sickness, and not for treating the common cold or as a sleep aid, especially in children, where it can cause hyperactivity instead of drowsiness. Pediatrician Alice Kubin reinforces this point, advising safer alternatives like cetirizine for children with hives, seasonal allergies, or skin rashes. For infants, saline drops and nasal aspiration are preferred, as they are safer and gentler. Diphenhydramine is found in over 300 over-the-counter products, often combined with other remedies aimed at cough, cold, or flu symptoms. Some experts suggest that in light of its questionable safety profile and limited efficacy, especially regarding nasal congestion, it should be moved behind the pharmacy counter, where trained pharmacists can recommend safer, second-generation alternatives. The American Pharmacists Association echoes this sentiment, urging caution with combination cold medicines containing diphenhydramine and advocating for professional guidance in selecting the safest treatment options. Crucially, studies show no clear evidence that diphenhydramine outperforms newer antihistamines. While it effectively reduces sneezing and itching, it does little to alleviate nasal congestion and doesn't show superior results in clinical trials compared to second-generation options. Despite this, it remains extremely popular. Over 1.5 million prescriptions are written for it annually in the U.S., not counting the countless over-the-counter purchases. So is it time to say farewell to diphenhydramine? Many believe so. Its therapeutic advantages are now overshadowed by the higher risk profile and available safer alternatives with fewer side effects. The question remains, in our quest for quick relief, do we sometimes overlook the bigger picture of safety and long-term health? Share your thoughts. Do you agree that diphenhydramine's days should be numbered, or do you think it still has a place in modern medicine? Should we remove Benadryl from shelves? Exploring risks and alternatives. Could a household remedy for allergies be hiding a dangerous secret? Let's explore why experts are now questioning the safety of a drug that's been a staple in medicine cabinets for decades. But here's where it gets controversial. Should a medication with such a long history be pulled from shelves, even if it means helping patients? Let's break it down. In September 2020, the FDA issued a stark warning about the dangers of the so-called Benadryl challenge, a TikTok trend where adolescents ingested dangerous doses of diphenhydramine, Benadryl, to induce hallucinations. The result? Tragic overdoses and deaths. The FDA emphasized that exceeding recommended doses could lead to heart problems, seizures, coma, or even death. This alarming incident sparked a critical conversation among medical professionals, including Dr. James Clark of Johns Hopkins University, who co-authored a review urging the reconsideration of diphenhydramine's place in modern medicine. Their argument? Second-generation antihistamines like cetirizine, Zyrtec, or loratadine, Claritin, offer similar effectiveness with fewer side effects. Diphenhydramine, first approved in 1946, has been a go-to treatment for allergies, insomnia, and motion sickness. But here's the part most people miss: its anticholinergic properties. These can cause confusion, dry mouth, urinary retention, and even blurred vision. Long-term use has even been linked to cognitive decline, including dementia. And the risks don't stop there. The line between a therapeutic dose and a toxic one is razor thin, making it a prime candidate for misuse, especially among young people seeking euphoric highs. So what happens in an overdose? Symptoms range from delirium and seizures to tachycardia and hallucinations. While treatments like activated charcoal can help if administered quickly, there's no true antidote. This is where the debate deepens. Should a drug with such a high-risk profile remain over-the-counter? Advocates for second-generation antihistamines argue these alternatives are safer, but critics worry about accessibility and cost. Pharmacists, often the unsung heroes of patient education, play a pivotal role in this discussion. They're the first line of defense against drug interactions and misuse, yet they're also stretched thin. Dr. Clark highlights the challenge. Pharmacists want to educate, but how do we reward them for it when their to-do lists are endless? This raises a critical question for healthcare systems. How do we balance patient safety with the realities of workload? After all, a good night's sleep isn't just about falling asleep. It's about staying asleep and waking up refreshed. What's your take? Is it time to retire diphenhydramine, or does its efficacy still justify its risks? Share your thoughts in the comments below. And if you're a pharmacist, How do you navigate the challenge of educating patients while managing your workload? Let's start a conversation that could shape the future of OTC medicine. Benadryl, outdated and dangerous? What you need to know. Recent warnings from medical professionals have sent shockwaves through the allergy medication community. Doctors are now cautioning against the use of an outdated and dangerous drug that millions have relied on for years. This isn't just about a minor tweak in the guidelines. This is a major wake-up call that could change the way we think about allergy relief. In a review published earlier this year by leading allergy experts from 2 prestigious universities, one allergy medication was branded as outdated and dangerous. The drug in question? Diphenhydramine, the active ingredient in the widely recognized brand Benadryl. This revelation has left many wondering what else they don't know about the medications they take. Some medical professionals are now advising patients to steer clear of diphenhydramine, citing serious concerns about its safety and effectiveness. These experts are pushing for safer alternatives, such as Claritin and Allegra, which they claim offer a more reliable and safer way to manage allergy symptoms. But here's where it gets controversial. Some are even calling for Benadryl to be moved behind the pharmacy counter, requiring a pharmacist's oversight for purchase. The review shed light on the potential dangers of Benadryl and similar drugs. Users can experience sedation, cognitive impairment, and in some cases, dangerous cardiac effects. These findings have sparked debates among healthcare professionals, patients, and the general public. Is it time to rethink our approach to allergy medication? And this is the part most people miss. While the risks are real, the solution isn't as straightforward as it seems. What do you think? Should we be more cautious about our medication choices, or is this just another example of medical overcaution? In response to these concerns, the Consumer Healthcare Products Association issued a statement on behalf of Benadryl's manufacturer, Kenvue. The statement stressed the importance of responsible use and urged consumers to always follow the directions and warnings on the label. While the debate continues, one thing is clear. This conversation is far from over. As the medical community grapples with these revelations, it's essential for all of us to stay informed and make educated decisions about our health. What are your thoughts on this controversial topic? Share your opinions in the comments below.